So will this be like on YouTube forever, or is it just like coming?
It's a live video, but it's going to go into our feed. So people that go to the Immerse YouTube channel will be able to watch it later.
Okay. For like ever, or just for a little while? Then
forever. It's uploaded on the channel, so it's be very nervous. I'm just kidding. Hi, welcome to Live at 5. You can tell there's a really big delay. So, what is good, everyone? Welcome to Live at 5.
Hey, everybody.
Yeah, I guess I can move this to where we can see.
This is really weird. I guess I shouldn't say stuff like that now that we're live.
That's okay. Here, we'll do it. This is what's live on YouTube, but here's our Zoom, so this is a more accurate representation of what's going on. Hey, everyone. Welcome to Live at 5. See, look, here we are. I'm going to click on it.
Oh, cool.
If you're here, check in and say, hey, I want to know who's here and how you guys are doing. We're going to get started here in just a minute, but if you guys don't know already, this is my sister Ashley, and she is a nurse here in town at UAMS. You'll probably give a better introduction to what you do. But as we all know, COVID is still alive and kicking and doing a lot of damage. So it's important that we are informed about what's going on with COVID and how we can continue to stay safe. The last time we checked in with Ashley was in March, so it's been almost a year. So I just kind of wanted to get some updates. There's Regina. Hi, Regina. Whoops, hey, Regina. I just threw my phone. But yeah, if you're here, check in. We're going to start doing better about giving you guys the $5 Kroger cards that are your reward is coming. Also wanted you guys to be aware that we're thinking about changing the reward for coming to Life Skills. We're thinking about doing kind of like a punch card style, which is like if you attend a certain number of Life Skills within a certain amount of time. So let's say you come to Life Skills every day for 3 months, then you might qualify to win like a $50 gift card to Walmart or to your favorite restaurant. We're going to try to make it a little bit better for you guys. And we also want to make sure that we're doing Life Skills topics on things that you guys really care about and really want to learn about. So whenever you guys want, you can always tell us what you want in Life Skills. And if even any of you have a life skill that you want to teach or that you want to get on here and you want to tell other people about, let me know. I'm so down to do that. But back to today, just want to give you guys, Regina says, okay, nice. Love it. That is exactly, we want it to be good. I want it to be good for you guys. If you guys have any questions or comments about how we should be incentivizing this, please tell us. So, like I said, here with my sis today. She works at UAMS, is a registered nurse. That's what it's called, right? RN.
That is what it's called.
So she'll be telling us a little bit about what's going on with COVID right now, maybe how it's changed a little bit since we last checked in March. And as you guys know, the vaccine is out and it's being administered to people. So it's important that we know about that and maybe some of the truths and the lies surrounding the vaccine. I think there's probably a little bit of both going around. So we'll talk about that. I see we got 3 people watching. Well, actually 2, because I'm one of them and Regina's one of them. So whoever you are, I want to know if you're here. In order to get the gift card, we do want you to be present the whole time. So we're going to be checking in, at the beginning of the class, in the middle, and towards the end. Can't be giving out gift cards to people who just swing in and catch the last 30 seconds. Not really how it works. So yeah, if you're here, check in. We'll give you guys a few seconds to do that.
That makes me want to drink water too.
Maybe we should get some
water break.
Just gonna get some water.
Oh, you have it. No worries.
So while we're waiting, how have things been in the hospital lately? Did you notice things change at all? Yeah. Since the vaccine came out, have things changed at all?
I just want to clarify that I'm not like a frontline worker for coronavirus. Just because I'm a nurse doesn't mean I'm like a hero in this day and age. We do see COVID patients and treat some pregnant ladies with COVID at my clinic, but I am in no way an expert. Also, I'm in no way representing UAMS in anything that I'm about to say to you. I'm not here on behalf of UAMS or representing UAMS at large, their opinions or facts about the virus. I'm just here because I'm a nurse and I love immerse, and that rhymed, which makes me really happy.
Someone make a rap out of that bar. Immerse. I'm a nurse. I love immerse. Classic. All right, we'll just go ahead and get started. Even if it's just Regina, you're worth it, girl. We'll go ahead and get started. So when we checked in March, things probably changed a little bit. What are the main things that have changed since March?
We know a lot more about the virus than we did in March, which is great. But there's still a lot of things that we don't know about the virus. The biggest change, though, really, is that we have a vaccination now, and people are starting to get vaccinated. So that's kind of the main thing that's changed, and the main reason that we're on Live at 5 today to talk about the vaccine.
Cool. Awesome. As far as precautions, should we still be taking the same precautions?
Yeah. In fact, even if you get the vaccination, that doesn't mean that automatically you don't have to social distance or wear a mask or anything. All of those measures are still going to be in place. And in fact, I'm glad that you brought that up, because I think what we've learned most over the course of the past year about the vaccination is the best way to protect ourselves, and that has not changed. And that's going to be keeping that social distance, because the best way to get the virus is person-to-person contact with someone who has it. And they might have it and you don't even know it because they may not have symptoms. So the best way is to do social distancing and to wash your hands a lot, and then to wear a mask. Those are the best ways to protect yourself from COVID. Even if you get the vaccine, you still got to do all that stuff.
That's good to know. I've heard a lot of people say, I'm vaccinated, I'm good to go, and live life as general.
I say that, but I'm just joking.
Yeah. Well, no, there are a lot of people who are like, once you get the vaccine, you're good, but you still have to take some precautions. So that's good to know. Yeah, it's good to know. We got a question. So I understand that the vaccine may prevent it, but is a good percentage of how it would affect people? Regina, kind of want to understand that question a little bit more. Are you asking,
I have some percentages. Let me give you an answer and see if it answers your question. Based on clinical trials, which there's a lot of rumors going on about the vaccine, that there aren't sufficient clinical trials and that it really hasn't been proven to be effective. And that's not true. In order for a vaccine to be released to people, it has to undergo a certain number of trials and meet a certain standard, and it has. So even though the vaccine is not FDA approved, it hasn't reached that standard. It has reached the standard of FDA to approve it as an emergency vaccine. So all that being said, the clinical trials have shown a 95% effective rate against protecting people from COVID, which is really good. So does that answer your question, Regina?
Yeah, so there's probably a 30-second delay, so she'll let us know here in a minute if it did.
In that 30 seconds, I'll just tell you a little bit about the COVID vaccine and how it works. Just in case you didn't know, whenever a germ is introduced to your body, your immune system creates some fighter cells that are called antibodies. And these antibodies are that's what fights infection whenever you get sick. So what a vaccine does is it introduces a very small amount of germ into your body so that your body will have that immune response and create antibodies without actually making you sick. So that's the cool thing about the coronavirus vaccine is it doesn't put COVID in you. There's a dead version of certain parts of COVID that gets injected into your body, and then your immune builds a response to it, which is pretty cool how that works. It's not 100% going to protect you from coronavirus all the time. In fact, it'll probably be kind of like the flu vaccine that you have to get it every year, but we're still kind of waiting to see how that's all going to shape up. Yeah, I think that the recommendation right now is for everyone who possibly can get vaccinated to be vaccinated. So I think that's the biggest question that you guys might be asking out there right now is should I get vaccinated? When the chance comes, should I get vaccinated? And for you guys, the youth at Immerse, y'all are young in your 20s or teen years. And the answer is yes, you should get vaccinated. there are very little risks and the benefit outweighs the risk entirely. So I'll talk about that too, but let me check in and see if there are any questions.
Yep. So Regina said that did answer her question. Glenda and Cavion, welcome guys. We're talking about COVID. If you have any questions about COVID or the coronavirus, same thing. Or if you have any questions about the vaccine, we're kind of doing a little Q&A discussion about that. So for you guys that have just joined, you can just type in the chat down there if you have any questions or comments about COVID and what's going on with COVID. So, yeah.
So right now, the people who have been vaccinated are frontline healthcare workers. Whoop, whoop. So I've had my 2 doses of the vaccine. On January 18th, they opened up the vaccination to be given to educators and people over the age of 70. And then in April, that's going to start the 3rd phase of vaccination, which is when they will open it up to people over the age of 65, as well as anyone age 16 and up who has some kind of medical condition, and they consider those people like higher risk. So the deal is the vaccine is just going to take a while for everyone to get vaccinated. Some of you may qualify in April if you have pre-existing health conditions. Others of you might even be in the 4th wave of getting vaccinated. Right now, the recommendation is this is who should not get the vaccine. Anybody who's less than 16 years old, and anybody who might have an allergic reaction to the vaccine. That's it. Everyone else is recommended to get it. So even if you're like immunocompromised, most of the time they say not to get vaccines, but they're telling people even if you are immunocompromised, you can get this vaccine. Even pregnant and breastfeeding women can get this vaccine. There's some rumors out there, you guys have probably heard about how pregnant people shouldn't get it or that it affects women's fertility. And I did some reading about that today, and it's just not true. So you got to be careful what you read and what you listen to and what you hear. It's good to be cautious. It's great to ask questions, but also just like check your sources and make sure you're getting information from not from like Facebook, but from reliable sources. So that might bring up some questions. I'm happy to talk more about that.
Yes. I actually had a question. You said people that are allergic or might have an allergic reaction. So let's say that one of us in the past has had an allergic reaction to a vaccine. So we should consider not getting the COVID vaccine if that's happened before.
Yeah.
Are there any other allergies? Like I'm trying to see if we have any youth out there that are allergic to something, who should be cautious about getting it?
Yeah, the vaccine does not contain eggs. It doesn't contain latex. It doesn't contain.
Do vaccines contain those things?
Yeah, most of the time, people who are allergic to vaccinations are either allergic to the egg component or the latex component in a vaccination.
I would have never ever thought that there were eggs in vaccines. That's ridiculous.
People are rarely like actually allergic to the vaccine. It's normally like some component that is in the vaccine for production purposes. So,
that's crazy.
Yeah, it would be really unusual for anyone to have an allergic reaction, but it does happen. I mean, I've heard of it happening. So what will happen is when you get the vaccine, you just need to stay in the place where you get it for like 15 to 20 minutes, and they'll monitor you to make sure you don't have an allergic reaction, and then you'll be free to go on your way. So if you've had an allergic reaction to a vaccine, just talk to your primary care provider or your doctor about whether you should get the COVID vaccine or not, and they'll have recommendations for you.
Awesome. I think I'm going to try to get mine next week because I'm in 1A or whatever. But there's this one pharmacy that's been like getting people in and out so quick. I didn't know it was going to be free. It's free for me. I know it's free for you too, but they kind of got overloaded, so I might have to go next week. That reminds me, what can we expect financially with the vaccine? Like, what about those that have insurance? What about those that have Medicaid? How is that going to work?
That's a great question that I really don't know the answer to.
Okay.
I can look up some stuff and get back to you guys on that. I'm pretty sure that insurance will cover it, and that it shouldn't be a financial burden, but I don't know. I don't know the answer to that.
For those of you watching that do have Medicaid, great news. That means you're covered, and your vaccine will probably be at least paid for in some amount. If you are not insured, you can get insured, and Emerse can help you. We don't do it for you, but through DHS, you can get you can apply for Medicaid and we can help you with that process. So if you want to talk to your coach or someone at Immerse about getting on Medicaid, we're here to try to help with that. Someone says, is the vaccine required?
No, it's not required.
Not required. It's up to
your choice. Your choice. But it will be highly recommended, I would think.
Yeah. We have someone saying that they are choosing not to get it.
Yeah.
I mean, you can choose not to get it.
No vaccine is forced. Yeah, it's your personal choice for sure. What we just want to make sure you have is the information to make your choice. That's what I tell my patients all the time. I'm not going to force anybody to get a vaccine, but you need to know your information and understand why you either want it or don't want it. That's all.
Yeah, we just want to make sure because, some people, I almost did not get the vaccine because I had a family member tell me it causes infertility. If you ever want to have kids, you should not get it. And then I boiled it down a little bit and turns out that she had heard that from someone who heard it from someone that posted something on Facebook. So we're just trying to make sure you guys do have the information that you need, because choosing not to get it for a reason that doesn't actually exist could actually end up really hurting you and other people. So that's why we're just trying to make sure we got the right information going. But it's, getting a vaccination is a privilege. It's not required. So you don't have to do it. Someone said they like food. Amen. I do too. After this, I'm going to be eating some food. So, was that related to the vaccine at all? Are there maybe some people saying that it affects how much you eat or something like that? Because if you're just saying you like food because you like food, amen, I hear that. But I didn't know if maybe that was related to the topic at all. If it's not, it's cool. Just want to make sure because I don't want to breeze over anything. Cool. We got 5 people with us. That makes me happy. That's awesome.
Something I was going to throw this in there. Y'all might already know this. The vaccine is 2 doses. I don't know if everybody knows that, but you get one, and then you get a second one 3 weeks later, 21 days later. So just something to know. So you're not surprised by that. I've had both, and I'm still normal. I mean, I guess I'm as weird as I always was.
So I've had some people get the vaccine and then reported feeling kind of weird for a couple hours after, maybe even some days. But I guess when I think about it, I would rather feel a little strange for a couple days than to have COVID and have it really impact my health or to spread it to other people. So personally,
I'm glad that you brought that up because you guys, I vaccinate people, not against COVID, but I do vaccinations for people like all day, every day, lots of vaccines for pregnant ladies. And I get people all the time that don't want to get a vaccine because they're like, I hear it makes you sick and I don't want to be sick. And what I always tell them and what I'll tell you is that a healthy person should feel a little bit weird after a vaccine. That means your immune system is working. Like it's supposed to do that. You get a vaccination, it boosts your immune system has a response, you feel kind of funky for maybe that night and maybe a little bit the next day, and then it passes and you're fine. That is exactly what should happen. That means your vaccination is working properly and that you have a healthy, active immune system. So just know to expect that. It's worth it. It's worth it. And it's way better to feel sick for a couple of hours. And it's not like you feel sick. You just may run a low-grade fever or feel a little bit cold and achy. I tell my patients, take a Tylenol and go to bed. You'll be fine in the morning. That is way better than getting COVID and being sick for 2 weeks or possibly spreading it to your friends and family, or worst case scenario, like ending up in the ICU because of it. It's way better to get a shot, if you ask me.
Yeah, love this. Someone just said someone at Immerse had COVID. Yep, you're exactly right. I know who you're talking about. And that person quarantined, and all of our staff were taking the right precautions, and no one at Immerse, it didn't spread to anyone at all. Just that one person had it and nobody else got it. So just a little pat on the back to Immerse. I think we're doing good. And I think y'all are doing really good too, because you guys have not brought it to us. And we haven't spread it to you guys. So a round of applause for all of us involved, because as crazy as contagious as it was. And I'm going to be honest, when COVID first hit, I was like, we all getting it. It's going to be really bad. It's going to be really bad, but it's going to be okay. And then no one's really gotten it except for the one person that I know of. If you're talking about someone different, then I'm going to shut my mouth. But from what I know, only one person's had it, and it was extinguished pretty quickly. So It just goes to show that if you're washing your hands, wearing your mask, keeping away from people that have it, then you don't have a whole lot to
Good
worry
job,
about.
people. Don't let your guard down, though. I'm going to be Debbie Downer because we have more people in the hospital with COVID right now than ever before, like record numbers.
Yeah.
So you guys are doing a great job. Keep it up. Don't let your guard down because community spread is still increasing all the time. And you're more likely to get COVID today than you were a year ago in March, even though everyone was freaking out in March. Like, it's more of an issue today than it was in March. So still be careful. Yeah. Also, even if you've had COVID, it's still recommended that you get the vaccination because we're learning that you can get COVID twice. And so even if you've had it once, go ahead and get that vaccine. It'll protect you from other strains and also hopefully help you not get reinfected.
Cool. This is all really good information. Does anybody have any questions about COVID or about the vaccine? Any comments about COVID or the vaccine? I'm gonna leave it up to you guys. And again, if you're watching, check in, just put who you are in the comments and say you're here. So I can keep track. And then how the Kroger cards are gonna work. A lot of you already know this. If you order the meals on Tuesday nights, we usually put it in your bag the next week. So for you guys that are here right now, next week, you'll get your card and your meal. For those of you who get your meal tonight and you have a card in there, it means we're getting you for last week. So that's how that works. For those of you that don't usually text in to get the meal delivered on Tuesday, that's cool. I'll get with you and find some way to give it to you in person. Or you can come to Emerse and pick it up. Whatever works for you and whatever works for me. So. Well, that's all I've got. This has been extremely helpful and very informative, especially to me. I'm going to give you guys just a couple more seconds. If you want to report back with any questions or comments about COVID or about the vaccine, just let us know.
Yep, I'm always available if you have questions as well. Like I said, I'm not an expert, but I can find out things for you. So never hesitate to reach out to me with your nursing questions.
Yeah, if you want to reach out to her, just text me and I'll connect you guys. I'll put my number in the chat. Someone says COVID needs to go away forever and never come back. Can I get an amen? Amen. This has been crazy and it's lasted. I remember thinking that quarantining would last a month and I was like, that is end of the world type of stuff. That sounds so bad. And here we are almost a year later and I'm like, I feel like this is just life now. I feel like it lasts another 5 years. I'd be like, well, okay. But still just the worst.
It's not going to last forever. On average, global pandemics, which newsflash, this is not new. This is not novel. It's not like this has never happened in the world before. It has multiple times. And the average amount of time for a global pandemic is 2 years. So
we can do another year.
We've done 1 year and who knows, that's not to say that we're going to have to do it for a whole nother year. But we're just in it together. We're in it together.
So true.
All right, we got anything else?
Nope, just more people. I
told you everything I wanted to tell
Just
you.
more people saying hey, which is awesome. Do you know, I have a question. Why can't people under 16 get it? What's the risk there?
Not enough studies showing that it's safe in children.
Okay.
Yeah. No one asked about the pregnancy. And
has that been the kind of the big myth going around, or the big?
Yeah, I read some interesting things about it. It got started. The story about how it got started kind of was rooted in a conspiracy theory, but also rooted in some movie that was made about how a whole pandemic was made up, and they made this vaccine that had what was the movie called? I don't know. I didn't see it, but there was a vaccine that everybody started taking, thinking that it was going to cure them from the virus, but instead it was this conspiracy to stop human reproduction. Anyway, it's a fiction story. But it's also it's not clinically proven. They have tested the vaccine on pregnant women, and they have also tested it on women of childbearing age, and a bunch of people got pregnant while they were in the trial. So that just the fact that happened, I think, is evidence enough.
Yeah, I had one friend tell me that it was also traced back to some German person who was involved with like political conspiracy stuff. So
Yeah.
who knows? But anyways, we know that it's not factual, and that's all that matters, really. Yeah.
They were saying that there's a component in the vaccine that is also a component in this disease that attacks the placenta and makes the placenta like unable to support a pregnancy. But what I read today is like the similarity between those two things is like saying that two people both have a phone number with 7 in it. Like it's not similar enough to actually make a difference. Like if I told you that, oh, you know, my phone number has a 7 in it, the chances of you guessing what my phone number is and matching it entirely is very rare. So that's how this misinformation gets started. You know, you'll hear, oh, the vaccine has something that attacks the placenta, when really it's like it's not true.
Yeah. Fake news.
Fake news.
All right. Well, I guess we'll call it there. My number's in the chat if you guys want to reach out for any reason. Huge thanks to Ash for your medical knowledge and sharing with us of important COVID things. So that'll be it for tonight, guys. Miss you all. All of you can expect to get your cards hopefully in the next week or two. Those who get food, you'll definitely get them. If you're not texting in for meals and if you're not like coming to Immerse regularly, we'll have to figure out something. I have to figure something else out, but we'll get it worked out. So you guys, in the spirit of COVID, stay safe, stay sanitized, wear your mask, social distance, wash your hands. So keep at it. Like I said, we're doing great. Immerse is doing good. But you guys be safe, and we'll catch you next week.
Thanks.
Bye.
Guys.